Good morning, everybody. I can speak at length on this topic, so I'm going to be relying on Dudu to manage my time. Asabif. Okay, I've got a tiny little screen here, Dudu. I'm old. There you go. Okay, all right. Thank you very much. So, NCDs, or non-communicable diseases, as it's called. Also, chronic diseases of lifestyle. Terminology differs depending on where you are and who you're speaking to. But basically, we all talking about the same issue and a very big important topic as well in terms of health. First, very quickly, who is the Heart and Stroke Foundation? Many of you, I see familiar faces here, so I won't go into details. You know us. We're an NGO, a non-profit organization. We have been in existence for 30-odd years now, and that is sad because it means that we're actually not doing what we should be doing or should have done a long time ago. And that is the real concern, that we're still in existence and that there is still a need for us at this point in time because our focus is on prevention of cardiovascular diseases, particularly the ones that's related to lifestyle, up to 80% of which is related to lifestyle. And so something is not working and something is going wrong, and we need to pay attention to that. We remember our parent body is the World Heart Federation, and in fact, the World Heart Federation is one of the members of the Global NCD Alliance. So that is how another way in which we linked to the NCD topic and the community globally. And then, of course, like Dudu said, we're one of the founding members of the South African NCD Alliance, together with Cancer, Diabetes South Africa, and PANGO, which is a patient health NGO group. So that's who we are in a nutshell. So just to refresh our memories and remind ourselves, what are NCDs? Terminology, like I say, changes, can be called chronic diseases of lifestyle. But basically what we're talking about is this is a collective term. And it refers to a basket of diseases. And the important thing about this basket of diseases is that these are the world's most common diseases. And it is the leading cause of death worldwide, globally. Now, many would say, okay, so big deal. We're all going to die at some stage. And generally at the foundation, most people tell us, yes, well, we're going to die at some stage in our lives. Absolutely, that's one certainty we have. The issue, though, is at which stage in your life. And the problem here is that it is affecting young people. So we call these premature deaths. And this is where NCDs become such an important thing, that the burden is now existing. We're seeing the burden in younger people. So this is premature disease. It's happening too early. What are these diseases? Well, we know we're talking about cardiovascular disease, diabetes, cancer, chronic lung diseases. For those who are not familiar with which diseases, for example, asthma. I'm sure many of you have noticed already. We're seeing more and more young children being affected by chronic lung diseases and asthma. And there are various other diseases, one of which is not on this very nice picture or illustration, is mental health. And mental health problems are also something that we're seeing increasingly these days as well, and we cannot fail to recognize that. Now, what is important? Why are these all in one basket? Well, because they share the same risk factors. And that is the root of the problem. This is the root of the problem, and this is where the solution lies as well. We need to pay attention to these risk factors and to the causes. And here we're talking about the standard things, and we've been talking about this for years now, about nutrition, unhealthy diets, alcohol abuse, physical inactivity, smoking, stress is another one that's been added to this group as well. And all linked to our lifestyles. In terms of just trying to very quickly paint the picture of the relative to each other, what the size of each of these burdens are, and this is global. Here we're looking at cardiovascular disease, That's huge, significant. In fact, it's the leading cause of death globally. Cancer, respiratory diseases, diabetes. But diabetes, you must remember, is increasing rapidly. That burden is growing very, very rapidly. And that's quite scary. For us at the Heart and Stroke Foundation, that's particularly worrying because it's one of our major risk factors. Lots of people with diabetes are at risk for cardiovascular disease and strokes in particular. So as you can see, this is a huge burden, and this is not static. It is not just a picture in time. It is growing. It is escalating. Now, why are we talking about these being diseases of lifestyle, and why are we talking about the risk factors? Because we know that there is, in all of this doom and gloom, there is the solution, that we can do something about it, but only if we commit it and if we do this together. We can, in fact, if we address our lifestyles, which is the root problem, and if we look for solutions there, we can prevent at least 80% of cardiovascular disease and type 2 diabetes and 40% of cancers. Now, those are big numbers. But we can prevent that if we address our behaviors in our lifestyles. We know in cardiovascular disease, 20% of those diseases are either inherited, genetic, family-linked, or comes with increasing age. But the rest of it, 80%, is as a result of our lifestyles. So hence, we're talking about NCDs these days. Sorry. But it's not that simple. It isn't just about addressing those risk factors that we saw on that illustration. We know that this is more complicated, and we're probably going to hear a lot more about changing behaviors later on, and why there are barriers to changing behaviors for obviously to change to and adopt the healthier lifestyles. We all know about the diabetes, hypertension, the fact that we're grappling with obesity, the overweight problem in this country, hypercholesterolemia, and those metabolic and physiological sorts of issues. We also know, like we spoke about, the risk factors and our behaviors. We know about all of that. But the real barrier lies here, and the underlying drivers. What are the barriers to us changing those behaviors and addressing that? And hopefully the rest of today is going to be spent learning about that and seeing how we can change behaviors, consumer behaviors, and address these issues. And in our country in particular, we have a very interesting context in that we have an emerging middle class, we have rapid urbanization, and so people are starting to adopt more and more unhealthier lifestyles. In fact, the unhealthy westernized lifestyle is becoming almost an aspiration for many people to be able to go out and buy McDonald's and KFC and afford that. So these are the sorts of things that we need to be paying attention as to what's happening here. We've also got a population that is aging. Yes, we are grappling with HIV and AIDS, but the country is starting to come to terms with that and control that. So we have people who are living longer, even those who are HIV positive are starting to live longer. And what we're seeing in that group of people is that more and more of them living longer but developing NCDs as well. So is there a crisis? And are we overreacting? Or is there an ISIS in this crisis? I thought I couldn't pass that opportunity by, since it's uppermost in our minds, sadly enough. But yes, and this is a sad thing as well, in terms of what are the social and the economic implications of these diseases. Now, it isn't just a health issue. What is happening here is that now we're starting to see an economic impact, an economic burden as well. And it isn't just on the healthcare system, okay? So when you look at, and this is the vicious cycle, because when you look at what happens when someone develops one of those diseases, what impact does that have on their family? What impact does that have on their pockets within the family, on their communities, and then, of course, the country as a whole. And this is what we're looking at. Now, the thing is, one interesting thing about this is that we are seeing more and more, in fact, the majority of the NCDs are occurring in the lower and middle income countries. Okay? So of that global burden, we are seeing the vast majority of it, 85% of it, happening in the lower and middle income countries, which is us, South Africa. Okay, so we are being affected directly. And this is what's happening in our country. So, increased exposure to risk factors. We're developing more and more these risk factors. We have more and more people, like we mentioned, because of the changes within socioeconomic changes within our country. We have more and more people spending on unhealthy products, loss of household income, driving up poverty levels. When they develop the disease itself, people take time off from work, don't get paid, people develop disabilities and cannot work. And of course, you've got too many young people dying. The impact on that on the family and then the communities, again, leading directly to poverty at the household level. What's happening with healthcare sectors? We know already our healthcare sector, our state healthcare sector, is unable to cope with the burden. And with this increasing, with this burden increasing, it's going to get worse. And so you've got households, individuals having to bear the costs, the medical costs. Again, an impact on household income, and then poverty at the household level. And so this is driving the economic problem that we're having as well. In terms of what's been happening globally, yes, the situation, the urgency has been recognized from a while ago, in fact, globally, that something needs to be done, it needs to be addressed. There's been a lot that's been happening over the years since as early as 2000. In fact, 2003 was when the tobacco control started coming in, and we've actually seen positive impact of tobacco control already in our country. In fact, South Africa has been one of the leaders, so that's been great. And then over the years, all of this that's been happening. Now, around 2008, 2009, there's been a little more, the momentum increased, and then in 2011 was when the political declaration was made at the United Nations, and I was fortunate to be at that meeting in New York, where the United Nations made the political declaration and tasked the WHO to go out there and create a strategy to address NCDs. And from there, things started moving very quickly. 2011, we had commitment from United Nations heads of state. 2012, they adopted targets. We had targets created by the WHO. 2013, there was an action plan. And in 2014, this was adopted. So good news, everything's moving in the right direction. And there has been buy-in from the United Nations, the World Health Assembly, the World Health Organization, that something needs to be done. Good news also in South Africa is that we have a very proactive Department of Health, and our Minister of Health has been very proactive that way. And so as early as 2011, we had an NCD summit and started creating our own strategic plan as well. And so in South Africa, we've got the strategy to address NCDs. And then in 2013, we launched the alliance, the South African NCD Alliance. Even better news was that just most recent news, actually, and this is on the 2nd of August 2015, it was announced that NCDs has now been integrated into the new development goals. Now, we're all familiar with the MDGs, the Millennium Development Goals, and that came to term this year, actually. So it started in 2000, came to term 2015. And so they needed to develop new goals and targets. And we have been lobbying, as the NCD global community, we have been lobbying to ensure that NCD targets have been included, hadn't been included previously. And it's one of the reasons why there's been so little funding to address NCDs. And it's one of the reasons why, for example, global philanthropic organizations haven't paid much attention to NCDs, neither have governments around the world. But now that it is included in the new development goals, and these are now, they can't be called millennium, of course, for good reason, but we're now calling them the Sustainable Development Goals, the SDGs. So you will start hearing about SDGs. And it's been integrated in that, and that is a huge victory for the global NCD lobbying community. So this is the language that everybody is talking about, 25 by 25, with the goal of reducing NCDs, premature mortality. Please note, this is premature. We all realize that with increasing age, we will see cardiovascular disease, cancers, diabetes, and all of that. But in younger people, we shouldn't be seeing it. So we're looking at reducing premature mortality by 25% by the year 2025, hence the language of 25 by 25. And of course, I won't go into the details of all of the targets that have been set. One big target of 25 by 25, and then the 8 other indicators. But these are relevant to us in that we're looking at alcohol, physical activity, salt reduction, tobacco, blood pressure, diabetes and obesity, and then, of course, in terms of treatment out here as well. Okay, so what about South Africa? Are we experiencing a similar crisis? Now, we know we have an unusual situation in that our biggest burden is HIV. Okay, so that tends to skew our picture a little bit versus the rest of the world. However, and, you know, like Lucia's mentioned earlier, we tend not to have enough data, and we're still collecting data. So we've gathered data from various sources, but the trend is, the picture is that, yes, we have too big a burden and that it is increasing. And we need to pay attention like the rest of the world. So these are 2 sources of data. The World Health Organization, where they showed that up to 30% of deaths in South Africa in 2008 were as a result of NCDs. This is Stats SA, and we're all aware of the complexities around Stats SA data and whether it's accurate and how one interprets that. But it is also giving us the indication that here we're saying all deaths being caused by NCDs was around 40%. So 30%, 40%, but we still know that it is significant. And you need to remember that this communicable, this part here, infectious diseases or communicable diseases, is a large part of that is as a result of HIV and TB. But NCDs are still there. Looking at other data and how we compare with the rest of the world, we don't compare very well. We need to be concerned, in fact. This is South Africa. This is other countries around the world. And of course, it's only Russia that beats us at the burden of cardiovascular disease and diabetes. Okay? Cancers, also not looking very good. This is South Africa, and we're up there with Russia, China, competing with the rest of them as well. Chronic respiratory diseases, bad news. Okay? So I did warn you, I'm the one that brings the doom and gloom, unfortunately. And the most recent stats that came from Stats SA is showing us, and this is showing us the trends over a few years between 2010 to 2012. And what we're seeing here is that cardiovascular disease, unlike infectious diseases, this is up there. Infectious diseases, the trend is it's decreasing. So we're doing something right, probably around HIV and TB. Cardiovascular disease, though, is going the other way. It's increasing. We have an increasing, a greater number of deaths that we're seeing here. In terms of neoplasms or cancers, increasing as well. Diabetes that sits in this group, also increasing. So we're not heading in the right direction at the moment. In fact, we're heading in the wrong direction. These are just a whole collection of numbers, and I'm not going to go through all of the details here other than to say that we've got too big a burden. It is affecting our younger people. When we say younger people, under the ages of 65, okay, between the ages of 30 to 65. Of course, if I look at the young people here, when I say 65, they may think, too old, but there are few closer to my age who agree with me that 65 is actually not old, not at all, okay? Now, some important points here. More than half of these occur prematurely in people of working ages who could have played an active role in our country's development, okay? The other thing is that these mortality figures, these death rates, they don't illustrate the scope of the problem. Remember that for every person who dies, there are 3 people who are surviving with disabilities, who need health care, which is impacting on their families, who need to take care of them as well. Okay? So that is, when we look at those stats, it's not giving us that big picture. And of course, this is not surprising when we consider the number of people who are carrying risk factors. And this is what I'm going to end with, my last few minutes, to scare us in a big way about exactly what the burden of the risk factors are in this country. Millions of us are carrying these risk factors, okay? But what is happening, this is just a moment in time, just a picture of so many millions of people who are inactive or who are hypertensive or diabetic and so on. But really, what does this mean? Is it increasing, decreasing? Are we controlling it with all the work that we're doing? Unfortunately, from the Heart and Stroke Foundation side, we're actually not doing all the right things, obviously, because these figures show us that the numbers are increasing rather than going down. We're not controlling it. We have the dubious honor of being called one of the fattest nations in the world. I mean, up to 70% of our adult women are overweight or obese. And that is bad. That is really bad. We know what that's going to do in terms of driving NCD levels. And so here we're looking at men. Okay, as you can see, 44, 45, that age group going up, it increases. Now, what you're seeing here is the blue bars are 1998 and the green bars are 2008, so it's 10 years apart. And it's showing you the trend, the rising levels over a 10-year period. And both men and women, it's increasing. We have more and more people who are overweight and obese. This is terrible. This is comparing us to the rest of the world. South Africa, look at our women. Only Mexican women are a little heavier than we are. Otherwise, we're up there almost. Very soon, I think we're going to lead the way. Alcohol, men in particular are drinking more and more, particularly in this young age group. That's terrible, not a good picture at all. Inactivity, this is really bad, particularly when we are all exposed to healthy lifestyle messaging, and yet we're seeing more and more people who are inactive. Look at this, in 25 to 34-year-old age group. I mean, that is increasing significantly. Hypertension, I won't go through all the details here, but again, we have the dubious honor of being one of those countries who has the highest prevalence of hypertension in our 50-year-olds and above. The highest. And this is the first that's been, now read this, because I am never able to say it out the right way. So let's read this so that you understand exactly why this is so shocking. We have the highest rate of high blood pressure among people aged 50 and over for any country in the world at any time in history. It's never been like that before, ever, anywhere in the world. This is the first time in history. Okay. What that means is we've got almost 8 out of 10 people in this age group being diagnosed with hypertension. The other big problem, and I won't go into too much of details about this, but what this is telling us is that it's the rule of 50s. Okay, of the big pot of people who are hypertensive, only half of them actually know that they have the problem. And of those who know, that half, that 50%, of those who know, only half of them are controlled on treatment. Okay, so most of us are walking around waiting to have that stroke or heart attack happen. Diabetes, same problem. Increasing incredibly fast, and that's a huge, huge problem for us. Tobacco use is the only one in this, and I'm coming to the end of my talk now, and I thought I should give you some good news at the very end. And the good news is that we are seeing the legislation that came in many years ago starting to have a positive effect. It's the only risk factor that is going down, is showing the downward trend. And that we should pat ourselves on the back for, but we've got a lot of hard work. So, we expect these diseases to be a major threat for the next 20 or 30 years. And we need to be doing something about it to ensure it does not remain that major threat. We spoke about the economic problems and the fact that it costs millions of rands to our economy. And it isn't just the fact that it is to the economy as such. Remember that what we're seeing in terms of health costs, we only see the tip of the iceberg. Everything else is happening below, underneath, like that iceberg, where it is affecting the individual, it is affecting the household, the employer, as well as government economically. And it just holds the country back. And so we have our plan, and I won't go into details about the fact that South Africa does have a strategic plan. That's the good news. We have our targets as well, and nutrition is very much part of that. Physical activity, tobacco, we're very, very grateful for having a champion, our Minister of Health, who is a great driver and a great champion around NCDs. And so it is now up to us to go out there and get done. And so I would like to conclude by reading out these key messages from the Assistant Director General from the WHO, Dr. Ala Alwan, who says that NCDs is an already enormous public health problem with increasing dimensions affecting both high and low income populations. It is responsible for millions of premature deaths every year, particularly in low and middle income countries. Lifestyle factors are at the root of the problem as well as at the root of the solutions, and that's important to remember. And that there are major socioeconomic consequences and negative implications for development in every country around the world. And on that note, I would like to say, this is Heart Awareness Month. We're celebrating hearts, and we're asking you to know your blood pressure. If you remember those stats that I mentioned in the rule of 50s. So go out there, get tested. And we've partnered with Dis-Chem, who's offering free tests so that we make this affordable and accessible to all of South Africans around the country. And of course, we're very grateful to Unilever for helping to offer community screenings as well. And of course, our ambassadors join our celebrities in getting screened yourselves. Thank you very much.